Hi, I'm Tim Wiedrich, Section Chief of the Health Resource and Response Section with the North Dakota Department of Health. We do have some microphones that are unmuted currently, and so let's go ahead and address that right now. Brenda Schaefer. Brenda, if I can get your attention and ask you to please mute your microphone, or we'll need to mute it. And so if I could just make sure that everyone is right now checking their microphones to make sure that you are muted, because at least to begin with, you won't be speaking. So in order to have a clean audio, to be able to allow everyone else to hear and participate fully, I need to make sure that everyone goes ahead and mutes their microphone. Anna Broers, if you can make sure that you're muted, and Julie Dickelman, if I can make sure that you're muting yourself, please, I'd appreciate that. We'll take a few moments just to make sure that we have all of the extraneous audio taken care of. All right. I think we're back on track in terms of the audio. Thank you so much for doing that. I know it's difficult to remember that, but it's very helpful for you to take that step to go ahead and mute. So as I was saying, I'm Tim Wiedrich, Section Chief with the Health Resource and Response Section, and this is a meeting that we've convened with long-term care to talk about the new program that is a recruitment program in an attempt to bring some additional people into the long-term care workforce to help alleviate some of the difficulty that we're having collectively with obtaining sufficient quantities of certified nurse assistants and temporary nurse aides. Now, it's really important to understand a couple of things right at the outset. That this is a brand new program and that it has some very specific intents to it. And so I'm going to set the stage a little bit at a higher level before we actually move through the more detailed conversation and, more importantly, to answer the questions that you may have. In terms of how this process is working, if I can, Clint, have you go ahead and bring up the slides, we're going to be moving to a process that will provide a $2,000 recruitment payment to new people that are either coming into the workforce as temporary nurse aides or people that are new to CNAs, newly trained and certified CNAs, but it's important to understand that we will not be bringing people in to the recruitment program that have been employed for the 6 months prior to their being accepted into the program in a similar role. Because what we do not want to do, what we will not do, is to have people move from one job, quit that job, and then basically come to another facility or rejoin that same facility. This is completely intended to have people that have left the workforce, have not been employed in those roles for the previous 6 months, and to basically assist their return back into the workforce. And that is either people that are brand new as temporary nurse aides or CNAs, or people that, again, are not employed previously for the previous 6 months in those two categories. So we're going to be needing to watch this very, very closely, and it is also important that people are understanding that these $2,000 incentive payments will be made, again, in order to augment, increase the existing workforce from where this program began. So let me drill down into a little bit more detail on those specific points. In order to be eligible for this recruitment payment, people will need to be employed on or after January 17th. People that were employed prior to that in these roles will not be eligible for this program, and so that becomes kind of the magic date that's determining the time frame. It has to be on or after January 17th. The only eligible entities that employment can be with needs to be a North Dakota skilled nursing, basic care, or assisted living facility. So these are facilities in North Dakota in those three categories. We are doing some research relative to hospitals and swing bed programs. I don't have the answer to that yet, so as of right now, those are not eligible. That doesn't mean that they will remain ineligible or that they will become eligible. We just don't know the answer to that, but I expect to have that resolved in the next couple of weeks so that we can be more definitive about that. And as I've already indicated several times, that people that are already temporary nurse aides or certified nursing assistants are not going to be eligible if they've held a position of those similar types of duties within the last 6 months of their application. So we're looking to have people either be newly trained or returning to the workforce after having left the workforce for at least 6 months. These are for folks that are coming on as full-time employees, and we've defined full-time as 32 hours to 40 hours. And so as those definitions are going to be somewhat variable within a facility, but the position that somebody is hired for needs to be with the expectation that they're working 32 to 40 hours. At this point, there is not eligibility for part-time employees. When it comes then to the payment, there's really two levels of payment that will occur for people that have met the eligibility requirements. The payment will come from the North Dakota Department of Health and will be paid to the facility, who will then pay the employee. We'll have someone on from Fiscal Care and More of our offices. Our fiscal office will get into more detail about that. And there's really, as I previously said, 2 times when payment will be made. After the first 30 days of employment, there will be an eligibility of a $500 payment of the $2,000. And then after completion of the remaining 5 months of that 6-month obligation, there will be another payment of $1,500. And at the time for the initial training, that the components need to be completed in order to have eligibility. So going back to when initial application is made to join the program, then you have to have already, the employee needs to already have secured employment. So there needs to be an offer, an acceptance of that offer, and the position needs to be one in which there's full-time employment for the employee in order to make them eligible. Then at the payment level, there needs to be the completion of the online training. That's an 8-hour online for for temporary nurse assistants, and of course the regular training program for certified nurse aides. The employer will need to have validated the skills that are practical skills and have completed whatever training that the facility has provided. And the attestation must be completed that those skills have been in place, and then also that the person was completely employed as expected for the level of payment that they're receiving. Other folks are going to be following me and giving you more detail about how all that process works in just a few moments. But I wanted to kind of introduce these concepts at a high level initially in terms of what the steps of the program are. And then finally, if individuals or the facilities need additional information, just go ahead and reach out to the Department Operations Center through this phone number, and that's 701-328-0731. This is a new number. It will be answered specifically for these questions, and that phone number is available Monday through Friday, 8 a.m. to 5 p.m. And so please don't hesitate to dial that number. That's the kind of the front line. If the person that's answering the phone doesn't have the answer, they'll reach out to the subject matter experts that will be necessary to answer the specific question that's coming in, whether it's fiscal, whether it's a question dealing with the registry, or if it's just more generic information that's being requested. And then finally, there is an email address as well that you can also be utilizing, that we're going to be monitoring Monday through Friday, 8 to 5 for these types of questions, and that's nddohdoc@nd.gov. So that's the information that I had intended to provide to you today. And again, we will have, after we get through our presentations, an opportunity for you to ask questions or make comments. We're looking forward to those. But for right now, I'd like to have Todd pick up the ball now and start to have some discussion about CNAs and temporary aid registries. I'm sorry, CNAs, temporary nurse aid individuals, as it applies to the registry. And so, Todd, go ahead and begin.
Just to give you a little rundown on how the registry side works for when you apply for a temporary nurse aid. You go out to our website, and the links will be listed out there. Haley will kind of go through some of that in a little bit, but you follow the appropriate links. Now, there are a set of links for a temporary nurse aid, and then right beneath that, it is labeled for the recruitment process. So make sure you're filling out the appropriate application. There's an initial application that the registrant will need to fill out, and then there will be an initial employer attestation that the employer will need to fill out. These are very short applications. They take 1 to 2 minutes at the very most. So that's the initial process. When we get those into our system, I go through each and every one individually to make sure all the information is there that we need. And if not, I will reach back to the registrant and let them know what is missing or what is not acceptable, and so forth. Once that is accepted, we will then let the registrant know that they have the temporary active status on the registry, and then at that point, their initial 30 days will start. Once their 30 days is up, the employer will need to go back out. There is another link for the second attestation, for the 30-day window. And then after that, there's another link after the additional 5 months. So again, there will be 3 attestations from an employer, and that's just so we can track things as they move along. And once all that is met for each stage, I will be in contact with the Department Operations Center and with fiscal as far as getting out payments, things like that. So that's kind of a overview of the process. The turnaround time to get things done is usually same day or next day. If it's done over a weekend, it's usually done by Monday, Tuesday at the very latest. So it's very quick turnaround on everything unless we are missing information. So just be aware of what needs to be on there, because we do ask for a copy of your completion of your online training, the 8-hour online training course. And sometimes we do get them in and they are blank. So we need to make sure that has the correct information on it. The employer attestation, we need to make sure that the employers are filling this out, not the individuals, because I cannot accept it if it's filled out by an individual. Okay. Now, if a registrant goes on and let's say they want to take the CNA exam, we can certainly, all that information comes in, and we can then get you moving forward onto the CNA exam as well. So you pass your CNA exam, your temporary nurse aid at that time will become inactive, and I will make your CNA active. All that information comes in, and I'm tracking all that in the registry. So if there's any questions as we go along on that through this whole process, feel free to reach out to me at any point in time. I can tell you where registrants are in their status, if I've received things, where we're at, things like that. So feel free to reach out at any point in time.
All right. Thank you very much, Todd. And now we're going to drill down into a little bit more detail, and that is going to be brought to us by Haley Schmidt with our Department Operations Center. And Haley's going to walk through a kind of an explanation about these links that Todd was referring to. So go ahead and take it away, Haley.
Okay. Clint, could you share my screen? Thank you. All right, so I just want to start off by letting you all know that this is a drafted application site. So if you all have boogied over and tried to find these links, they are not there yet. We just need them to be cleared by a few more people before we can make this live. But this is what the system is going to look like when you go in to apply for your temporary nurse aide, and what it will look like for your employees if they are applying for the temporary nurse aide recruitment program. So if you see here, we've got the two different headings like Todd mentioned. So this is the temporary nurse aide section. That is where your registrant / employee / applicant will have to go through and apply to actually become a nurse's aide. As far as the recruitment program goes, they will have to come down to this section to look at the links below. So the first thing that they'll have to do is fill out this temporary nurse aide recruitment program application. So I'll just click in there to give you guys a quick peek about what this looks like. It's pretty standard. So the first thing that the applicant is going to do is go through, fill out their demographic and information so we know who they are. At the bottom here, they're going to be choosing how they would like to be notified. And this is where we're going to notify them if they do indeed are approved for the program or are not approved for the program. On the next page, just standard disciplinary questions. It's going to look like what they would normally see on an application for the temporary aide or for the CNA licensure. And then this next page is where the applicant is going to have to sign that they understand the requirements for the recruitment program. So if you see here, they're going to certify that they've given us all of the correct, true information, and also acknowledging what we require to be eligible for the recruitment program. If you have applicants that are asking questions to you about, what are the requirements, this link here, this hyperlink, will bring you to that memo that we sent out earlier in the week. And if there's any questions further that aren't answered in the memo, please use that doc phone number or that email, and we will answer your questions as soon as we can. And again, those are both available Monday through Friday, 8 to 5. I'm going to go back to the home page here so we can walk through the attestation. So as Todd was describing, there's going to be 3 different attestation points for the employer that they must go through in order for the applicant to receive these payments. So we are missing, there's 2 listed here, but there will be another one added that says initial attestation. So they will have to do an initially when they gain employment, you'll have to fill one out. Again after 1 month, and then again after 5 months. So if you take a look here, the 1 month attestation, we'll ask that you put the employment. Todd, is this for the applicant or for the employee to put the social security number in for your system?
It would be for the facility to put in the last name, the date of birth, and the last 4 of the social.
Of the applicant, correct?
Correct.
Okay.
Of the applicant.
Okay, thank you for that clarification. So this will be the information of the applicant, so the employee that you are attesting for. And then here we'll have you go through and fill out your demographics, which facility you are with, and that will include the address there, a good phone number for you, your email, and then the start date of the applicant. So we would like you to put the day that the applicant was employed with your facility. And then you'll be signing here, and you'll be noting that the trainee has completely trained to do the duties assigned at your facility, whatever those may be, that they have completed the temporary aide program, the 8-hour online program, and that they have indeed fulfilled the 30 days or the 5 months, and that they have met your 32 to 40 hour per week requirement in order to maintain full-time status when employed. And then after signing that, we ask that you put your name in this box, your title, and then date your signature, which you'll put up in this box. Let's see here. So once again, just to remind you, you'll have to do that 3 times. So one attestation will be done initially when you gain these people as employees. After 1 month, you will do it again, attesting that they have worked full-time with you for the 30-day requirement, 32 to 40 hours. And then once again at the 5 month. These reflect the payment times. So if you all took a peek at that information that was sent out earlier in the week, the first payment will be given out after 1 month of attestation. So they will receive the $500 at that point. And then we will not be able to give them the second payment until we receive that third 5 month attestation from the facility they are employed with. And I think that's all I have,
Thank
Tim.
you so much, Haley. So just to be really clear on this issue, the total time is 6 months that they will be employed as the minimum commitment. Now, obviously, it's our hope that they would continue on, and if they came in as temporary nurse aides, that they would convert over to CNAs, and so hopefully we'll get some residual impact beyond the 6 months. We'll obviously be very interested to see how that, in fact, works out. I also wanted to point out that we are, at this point, limiting it to 100 individuals. And so that is a process that, frankly, will have our first round of approvals for the applicants beginning on the 31st of January. We have the initial first round. So any applicants that are joining a facility after the 17th, completing the 8-hour training program, you've validated that as your employee, and now they're filing application with us on or before January 31st. We'll look at that first round, see how many applicants we have, and then begin awarding. You'll get notifications by the end of that week, which I believe was February 4th, if I remember right. In fact, I'm positive of that now. So that's what will happen during that first round. We'll continue after January 31st to receive additional applicants and continue to process them as they're being received, frankly, until the program ends, which will be ending in May. And so that will be the cutoff times that we'll be doing this specific recruitment process. That doesn't mean that the temporary nurse aide program, in terms of people becoming registered as temporary nurse aides, the way that's built is that we intend to continue that for 4 months beyond when the presidential, the executive branch at the federal level has ended that program. At the time that emergency declaration ends, temporary nurse aides will continue on for 4 months following that date, whenever that occurs. That has not occurred yet. We don't know when that specific level will occur. But in terms of the recruitment program, these $2,000 payments, that began January 17th, and we intend to end that in May, at the end of May. All right, so with that, let's go ahead and come back to Todd and get additional information from Todd about the facility responsibilities for the recruitment process. Todd?
Tim, for the facilities, we just need you to make sure that you are filling out the appropriate attestation that needs to be filled out. I do receive applications in and I don't get attestations, and so registrants are thinking that they should be active and facilities are wondering why they're not active, and so we just need to make sure that the appropriate attestations are being filled out for the individuals. I do have some individuals that fill out their own attestations, so we need to just kind of keep an eye on all that. Once we receive all that information in, I will be, like I said, in contact with fiscal as far as getting out payments and stuff like that on a timely basis. So I'll get them turned around as quickly as possible. It's just, we need the facilities to make sure that the registrants when they're applying or filling out their information, they're filling out the appropriate one, because if they fill out the wrong one, for instance, for the standard temporary nurse aide, not for the recruitment program, now we have the wrong application. We can't process that through, stuff like that. So just be aware of what app or what links you're clicking on for what application, so we're getting the appropriate information in is all. So just kind of be aware of all that information.
All right, thanks, Todd. Well, let's dive a little bit deeper on the fiscal side now, and joining us is Karen Bohr with our Fiscal Services Division in the North Dakota Department of Health. And Karen has some additional information. Floor is yours.
Okay, and can I share a screen here as well?
Please do.
This is a little bit slower than maybe we wanted, but in order for you to get payment from the state of North Dakota, any vendor that is requesting a reimbursement or a check from the state of North Dakota must first be registered with the state as a vendor. And through that process, you would fill out an online application along with a W-9 and submit it through OMB's, the Office of Management Budget's website for vendor registration. And what they will do then is they will give you, it's most likely going to be a 6-digit number, but a number that you can then share back with Todd or the doc as to, here's the vendor ID that's been set up for us. And then when we go to make a payment, we have to apply payments to that specific vendor ID. And from that, it will pull up your address information and your payment information. When you go to register, you can indicate whether you prefer to be paid by check or by an electronic deposit to a bank that you would identify during the registration process. But I don't know what the easiest way is. If you guys want to write this down, or if, Tim, you want me to get this out, but it'll go out later. But here's the website that you go to. And once you're in there, underneath as vendors, you just click on this link here for the online application, and that will take you into the application process. We'll also want to, at some point, you want to download the IRS form W-9 and get that completed, because you will need to send that in with your application. But this will walk you through the process to get registered with the state. If you are already registered, you would not need to go through this again if you've been, I believe, registered or have received a payment within the last couple years. I do know that if you have not, even if you registered, say, 5 years ago, but you haven't received anything, they do move it to inactive. So you probably would want to double check to make sure you are active. Are there questions on this process?
All right, we're going to come to questions in just a second, Karen, and
Okay.
Again, it's my understanding that irrespective of state agency, so if you've received payments from any state agency that within the last couple of years, that you would already have this vendor number assigned. So it's not necessary to do this just for receipt from the North Dakota Department of Health. Is that correct?
That is correct. That this is the registration process to receive any payment from any agency with the state. You get one vendor ID for the whole state.
All right. So a number of the facilities likely are already registered, and so we hope that this is that you're finding this to be a simple process. We've tried to put most everything online as this is rolling out, and tried to make this as convenient as possible. So with that, we're about to come into the question and answer portion of this. I know that we have a pretty large group, but I'm going to attempt to not do these responses by region. I'm just going to ask if you have a question or a comment, just go ahead and unmute your microphone, and be mindful if other people are already speaking before you unmute. And we'll see if that goes all right. If it doesn't, then I'll start to divide us up into geographic regions to ask the questions and answers. So with that, we're ready for your questions. Go ahead and unmute your microphone.
I just had a question in regards to the skills curriculum, and if there are any expectations, like how many hours do they have to meet on that, since there is an 8-hour educational course in regards to that.
So I am going to, I noticed that we had some health facilities staff on board. And so before I attempt to provide a direct answer to that, let me just see if anybody from our health facilities team wants to chime in on that issue, or Todd.
This is Kelly Beachy. Repeat your question one more time, please.
The skills portion of the education, is there a time expectation or certain curriculum that we have to follow?
No, there isn't, Sarah. What's required is just that 8-hour online course, and we expect the facility to train that nurse aide into your facility doing the appropriate tasks that you want them to do. And there isn't a certain time level on that. Most facilities have some type of a checklist that when they've validated that they're competent in that skill, that they can go ahead and do that on their own.
Okay, and then just a piggyback question. Do the people that are providing that education, do they have to be approved by the Department of Health to be those instructors, or could it be, for instance, like a CNA mentor?
They do not need to be an approved nurse aid training program by the state. So a lot of facilities do have a CNA mentor who is capable of doing the skills. So that would be fine. They would probably need to be signed off, like it's typically done at the facility, signed off by a nurse saying that they are proficient in that skill.
Thank you so much, Kelly.
You're welcome.
All right, we're off to a good start. Great question. I just want to ask that we communicate in this oral format on the meeting. We're not monitoring the chat at this point, and so please go ahead and state your questions by unmuting your microphone.
It's Mary with Able in Dickinson, and was wondering if DD providers are included in this, because I didn't see that as a listing of facilities.
So at this point, the priority will be skilled nursing facilities, and then there will be eligibility from assisted living and basic care. The program will be expanded if, in fact, we have insufficient applicants for those priority levels. But again, of the 3 that were listed, skilled nursing will take priority. Thank you for your question.
Will these slides be available to be sent out so we can review them later on, or be sent to our other colleagues?
Allison, we have an archive of this program. So at the very end, we'll go ahead and share that website with you, and we can post the slides as part of that archive.
Okay, perfect, thank you.
Thanks, Alice.
This is Vanessa. I will make sure that I send that out in my most recent update once it's available, so they'll have it there as well. Thank you.
Excellent. And then Vanessa, at the same time, we know that we need to do a mailing for the Karen Bohr OMB website. Karen talked about the OMB website that we'll want to make sure that we get in the hands of facilities as well.
For that, thank you.
I bet Sean's going to have something to say here in just a second.
Yeah, Tim, on the vendor registry, since most of us are probably registered, is there any process then we need to do with that to get the check pay, the system going?
I think the short answer is the attestations that were talked about earlier, but nothing beyond those attestations.
Well, I think one of the presenters said that we have to register as a vendor to get the check.
Yeah. Sean,
so I was kind of clarifying that process.
Let me clarify that there are really 2 things that are happening here. that registration process is with the Office of Management and Budget. And that's the fiscal side that goes for any vendor, irrespective of what state agency is making a payment. So if you're not registered, if you haven't received any state payments in the last couple of years for any purpose, then you're likely not registered in that system. So that's what was being referred to. You'll have to check to see if in fact you have an OMB, Office of Management and Budget registration. But then coming to your point, I think all the long-term care facilities are going to be registered in the nurse aide part, which is the program part. And so I don't think it's likely that you'll need to register in that system, because I believe everybody's pretty much registered in that already. Todd, do you have any additional comments on that?
No, our facilities are being pulled right now from the health facilities licensing. So we're pretty much mirrored what's already listed out there in the, as far as licensed healthcare facilities through Bridget's side of things.
All right. Sean, did that answer your question?
Thank you.
Karen, you had additional comments?
Yeah, and I was going to say, and then basically for the clarification is once they've signed off and said, yes, go ahead and send this $500 or whatever the dollar amount, they've got 3 applicants for $500. Once Todd and those guys have signed off on that, they would submit it to us. And it's at that point that if you're not registered with the state, we can't process a payment in the state accounting system.
Great. Thank you for that, Karen. Great question.
Hey, Tim, this is Shelley. I wanted to just clarify one issue on your initial screen. And first of all, thank you very much for developing this program. We're excited about it. We hope within the next 30 days we have 100 new people. So we are excited, and thank you. On your initial screen, it talked about anyone having to be employed after a certain date. And I think the date on the screen said January 1st, 2021. I believe it should be January 14th, 2021, and it should be January 14th, 2022. Do you want to just check that and make sure so that when you send the slides out that we don't add some confusion there?
Oh, thank you so much. My goodness, I did not see that, and I know exactly who to blame, and he's talking right now. So that is my error, So the actual date that we used is January 17th, because that's the date that we did the notification of 2022. So let me reemphasize that. January 17th, 2022. And apparently I can't tell the difference between the 2 years. So my apologies for that. Again, the beginning date of this was the date that we sent the announcements out, which is January 17th, 2022. I apologize for that error. And thanks for catching it, Shelley.
Tim, John at St. Benedict's. Relative to the OMB, is there a simple way to just check and determine whether or not you are a vendor? I've wandered around the site just a little bit this morning and don't see that readily apparent.
Karen, can you help us there?
I guess if it's not clear, maybe the best thing is that we can check for you. We can go try to pull it up and see if you're listed as active. So I'm trying to say that what I'm trying to say is I think our fiscal team can take care of that for you. So Tim, do you want to just, if they reach out to you, send me the information and I can check, or how do you want to?
No, that sounds like a reasonable way to do it. And so just make contact back with us at the phone number that was previously indicated, which is, and I'll find it here in a second, which is 701-328-0731, 701-328-0731. Again, that's Monday through Friday, 8 to 5. Give us a call. Let us know that you want to check on the status of your OMB registration, and we'll have it looked up and get the information back to you. And we don't want you spending a bunch of time trying to figure out on the website whether you're registered or not. Thank you for that, Karen, and thanks for the question.
Tim, this is Amy Curran. I have another question for you. And I missed the first couple minutes, but Is this considered regular income to the employee and all applicable taxes withdrawn just as any other income?
Thank you, Amy. You missed the best part of the program. It was right at the very beginning. We had marching bands, and it was just an amazing thing. I'm sorry. At least I think I'm funny. Let's go back to Karen. And Karen, do you have a response to that?
If I could have you repeat that question, because I was actually reading a text from Jennifer, because she's checking with O&B to see if there's an easy way to look it up, that whether you're registered with the state. So I missed your question.
Yeah, the question.
Okay, is it?
Go ahead.
Oh, is this for the employee considered regular income and all taxes and everything applicable to it as we would do typically?
I am not a tax advisor, but I will tell you that, yes, I believe you will need to send it to as a regular pay and have regular FICA and all of that taken out as well, because the IRS would consider this to be bonus pay, so to speak.
Okay, and then the second question is, and I don't know if anyone on here can answer this one, is do we track this to be offset on the cost report as grant income?
So let me see if anybody from the group, not the state health department, but from your peers, Amy, does anybody have any comment on that? Amy, you may need to do some additional research on that. We don't have the answer here at the health department for that.
Okay, thank you.
Thanks, Amy. Other questions or comments?
I just want to reiterate what Haley said, that these links still are not live because we're waiting for final approval on them. So we're hoping early next week they'll be live for the public.
Thanks, Todd. All right, we're getting down to last call. We do have 15 additional minutes scheduled, but if there aren't any additional questions or comments, we'll go ahead and start to wrap this up. All right, well, I'm not hearing any additional questions or comments, and so thank you for your participation today. I want to thank all the team, all of the team members relative to the presentations that were done, and thank you to the Long-Term Care Association for your assistance in pulling this together as well. This is a team effort. We hope that this is successful, because I think that this can be, if it is successful, a pretty significant tool to help offset some of the workforce shortages that are being experienced. And so if we can get 100 new people or people return to the workforce, I think that we all collectively think that would be a very good thing. So thank you for that. Let me just remind you, if there are questions about this program, I'd like you to dial 328-0731. That's 701-328-0731. And also that this program is archived, and that is at health.nd.gov/ET. And so you'll be able to find that and any of the other previous programs that we've done in that same website area. Clint has the number up for us in terms of if you have a question about this temporary nurse aide or CNA recruitment program. That is 701-328-0731. All right. Thanks for your participation. We look forward to having further conversations with you. Take care.